Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog blog post about a long-term side effect called chemotherapy-induced cardiomyopathy. Just as a frame of reference, I was diagnosed in '94, underwent conventional chemotherapy and radiation for the next several years, 95, 6, 7. Stopped once I was told by my oncologist, we can do nothing more for you. I won't go into it, but bottom line is I was end stage and then figured out how to get into remission. By 2010, woke up one day, flipped into chronic AFib, heart rhythm went all over the place. Was soon, a month later, was diagnosed with chemotherapy-induced cardiomyopathy. Bottom line, a number of chemo regimens have been shown to be cardiotoxic. Specifically, in my case, I underwent vincristine, doxorubicin, Cytoxan, busulfan, melphalan, all of those therapies over about 8 months, some more than others. Should be no surprise that my heart was damaged severely. At the time, I was a 35, 6-year-old and in fairly active, in fairly good shape. It's surprising that it took till 2010 before the damage reared its ugly head. It's important to note that cardiotoxicity, chemotherapy-induced cardiomyopathy, can happen immediately while you're undergoing therapy, or it can happen 5, 10, 15, 20 years later. In my case, 15 years later. If you go online and you research the prognosis, it's not good. About half of people with cardiomyopathy die after about 10 years. In my case, I'm shooting this explainer video in 2021. It's been 11 years for me. All of the evidence-based, non-toxic therapies that I undergo, exercise, heart-healthy diet, specific nutritional supplementation, lifestyle therapies such as whole body hypothermia. There are a number of therapies. All of those I've been tracking over the past 5 years. A number of metrics, those specifically tracked by annual echocardiograms. And I list at the bottom of this blog post all of my metrics. Bottom line is I've stabilized and in many cases improved my ejection fraction. My blood pressure is stable. AFib is never gonna, I don't ever think I'll achieve a normal heart rhythm again. But I've reduced my risk of stroke. All to say, I manage my chemotherapy-induced heart damage pretty well. And I also need to mention it's not all about either or conventional therapies or non-conventional therapies. I simply encourage, I don't want to undergo any toxicity. In your case, I think you should consider evidence-based, non-toxic therapies first. If you can't manage your symptoms, if you can't improve your ejection fraction with exercise, diet, supplementation, lifestyle therapies, talk to your cardiologist. Consider the normal standard of care therapies, metoprolol, water pills. There's all manner of therapies out there. Perhaps a combination complementary therapies can lower your doses instead of 50 milligrams of something. If you undergo complementary therapies, exercise, weight loss, you can lower that dose. That would be good. So if you have any questions, comments, scroll down the page, send me a question or a comment. I will reply to you ASAP. In the meantime, thank you for your time and attention, and be well.